Welcome back to my channel. Today we're going to discuss a topic that is very common in my practice, and that is the aging of the eyelid region. And we're going to discuss not only the anatomy of the eyelid, but also the solutions to treat both surgically or non-surgically wrinkles, sagging, and bulging tissues around the eye. For those who are new to my channel, I'm a facial plastic surgeon with a particular focus on the eyelid area. I've been focused on eyelids for over 35 years, and I treat both functional and cosmetic problems. I believe I can give you in-depth understanding and insights about the aging process around the eye. When we talk about the anatomy of the eyelid, I like to talk about three components: skin, muscle, and fat. I'm going to talk first about fat, which is the deepest layer of the eyelid. This has to do with the volume of the eyelid, what we call the volume that makes up most of the eyelid. So protruding fat pads can cause bulges on the inner corner of the eyelid specifically, and on the inner corner of the lower eyelid, sometimes out at the corner of the eyelid as well. So there's actually 3 fat pads on the lower eyelid and actually 2 on the upper eyelid, the medial fat pad and the central fat pad. These fat pads can bulge forward, and classically the explanation for the bulge is that there's a septum, a barrier, which weakens with time and allows the fat to passively come forward. The fat is actually not increasing in volume. It is actually just spilling forward. There's no new fat that's formed around our eyelids. It looks like it's new, but it's not. It's actually fat that it resides behind the eye and actually just spills forward. The reasons for that fat to spill forward, however, is not well understood. There are fibers that hold the fat in place behind the eye and weaken with time, and that allows the fat to spill forward. It isn't just a septum, which is like a dike, that holds the fat back. So we just discussed patients who have protruding fat pads, which cause bulging of fat in the inner corner, lower eyelids, but there are some patients who actually have atrophy of fat, which create hollows both of the upper eyelid and the lower eyelid and depressions below the lid. The solutions for that problem are entirely different. The next layer is the muscle layer deep to the skin, and also the ligaments that become lax with time. The muscle itself can become redundant, and you can get folds and thickening along the lower lid and upper lid. The laxity of the ligaments can lead to sagging of the lower lid as well. The layer on top of the muscle is the skin layer, and that layer can be impacted by long-term smoking, sun exposure, and of course genetic predisposition to wrinkling and aging, where there's a loss of collagen and elastin, and laxity of the skin itself occurs, and that can be addressed as well. I have discussed all the components that contribute to the aging of the eyelid. Luckily, we have solutions to treat each one of those components to rejuvenate your eyelids. So let's talk first about preventive measures to try to ward off the aging process. The first thing I would recommend is use ultraviolet A and B blocking sunglasses, which block the ultraviolet rays, which can contribute to the denaturization of collagen and wrinkle formation and sun damage. So that's number one. Number two, you can use sunblocks on your lower lid that have titanium and zinc and apply them particularly in the lower eyelid. In the upper eyelid, unfortunately, they can melt and get in your eye, so it's a little trickier to use sunblocks on the upper eyelid than the lower lids. One other thing I like to suggest, if you smoke or drink, that to curtail the amount of smoking and drinking, because that will reduce the acceleration of aging around the eyelid. There are non-invasive approaches to enhancing your eyelid. Specifically, most of these over-the-counter products tend to draw water into the area and increase volume around the eyelid, so it reduces the appearance of wrinkles. There are other components like ferulic acid, vitamin C, which are antioxidants, which also reduce the wrinkling and brighten the skin and can make you look more youthful. Many of the products contain squalene, hyaluronic acid gels, marine algae, and numerous other ingredients, which is not entirely clear what exactly they're doing. But they do help in terms of enhancing the appearance of the eyelid skin specifically. Now, it doesn't help with the bulging of fat, which is underneath the skin itself. So it's purely a problem to address the skin itself, not the bulging fat. Now, in regard to prescription items, things that contain retinols or retin-A can change the physiology and improve the collagen and elastin deposition under the skin, and can, if it's used consistently, can improve wrinkling on the skin. And typically it's done on the lower eyelid skin. Now, on the upper eyelid, there are things called contour strips, which are applied to the upper lid, and that can create a elevation of the eyelid and sometimes create a crease. And these are purely temporary. They're used like on Saturday night when you go out and you want to look a little more youthful and you want to get rid of that sagging upper lid skin. You can apply these little plastic strips on the upper eyelid, and that can again camouflage some of the age-related changes you have. Now, if you have exhausted all of these over-the-counter products or prescription items like retin-A, and you don't feel that it's really doing the trick, it's probably because it's not addressing the components which can't be addressed with topical medications, namely bulging fat or sagging muscle or the ligaments that are found in the corner of the eye. So in those cases, it does require surgical intervention to trim those and contour those so that you look younger and fresher. Now let's dive a little bit more into the surgical corrections of the aging eyelid. And in regard to the upper eyelid, commonly I just remove skin only on the upper eyelid and preserve the muscle layer itself. But there are patients who have redundant thickening of their upper eyelid muscle, and that has to be contoured as well. And the inner corner of the eye, there's usually a bulge of fat which has to be trimmed and contoured down. Otherwise, post-operatively, if you just remove the skin alone, you may see a bulge of fat that you don't like in the inner corner. So we address that bulge of fat usually right from the start. The redundancy of the upper eyelid skin can be contributed to by the downward descent of the brow, and so some patients do require brow lifting as well to raise the brow up, and then the amount of skin that's left over is trimmed. So if you want to learn about brow lifting, please refer to my brow lifting video. In regard to the lower eyelid, there are actually several different components that we have to discuss. One is the bulging fat, one is a lax lower lid skin, and the third component is lower lateral canthal laxity here. First of all, the incision to access the bulging fat of the lower eyelid can be done within the inner eyelid. It's called a transconjunctival blepharoplasty. The second approach is to do a pinch incision below the eyelashes, and that's just to trim a little bit of the skin, keeping the muscle layer intact. And the third aspect of this is to take some of the fat, which is bulging, and transfer that fat into a hollow area by draping it over the rim of the orbit. And occasionally I take fat from the abdomen or from the hip, spin it down in a centrifuge, and then inject a small amount of fat into the lower lid to fill in hollows and depressions. The last component would be to tighten the lower lateral canthal tendon, and that helps to tighten the sling of the lower lid against the globe. The last option to discuss is laser resurfacing of the lower eyelid skin, which can reduce wrinkling of your lower lid. I use erbium YAG laser. Other doctors may use a CO2 laser or an erbium glass laser. The choice of which laser to use is really dependent on the depth of the wrinkling you have and how quickly you want to recover following the treatment. As you can see from going through each one of these steps, whether you do a non-invasive approach or you are going to go forward with surgery, it's quite a complex subject, and each eyelid is unique and has to be analyzed in each individual, and therefore you should seek out a specialist who does a lot of eyelid surgery in order to obtain the best final result. So I hope you found this video to be informative about the aging of the eyelid, the anatomy of the eyelid, the solutions on how to treat the aging eyelid. And if you have any further questions, please leave them below. I'm happy to answer them. And please subscribe to my channel, and I look forward to seeing you again in my next video.